of this session of this event here, and we're here on Sunday at 1 p.m. Eastern. And I got to tell you, there's a lot of you that have been here the whole time, literally the whole time. I'm just really, really, really blown away at the feedback, the engagement. Arena's joining me on stage. Dr. Jacobin, you've been doing these events with me for years. Isn't it exciting to see everybody really kind of getting involved and, sharing their feedback?
Yeah, absolutely. It's amazing. I feel like every show there's at least, a handful of new people that I've never met before that are coming in and connecting. And then I get to reconnect with all the people I met in the prior shows. So it's always very fun, very social.
And Bruce, thank you so much for joining us today. For those of you who don't know, Bruce Carnahan has been kind of kidnapped by the optometry and optical industry, and he's just been such a breath of fresh air. Bruce, how are you today?
Great. So it's just after 10 a.m. in boiling hot Arizona. We're already in triple digits already. Just amazing. And I wanted to say hello to everyone in the other time zones and people overseas. It's either Marvelous Monday, early Monday, or late at night. So also wanted to recognize both your efforts. I mean, I could not have even wrapped my head around imagining doing this without all of your help and support. And even backstage, we were solving a little technical mystery. And between you two, you solved it. So thank you. So yeah. So a little context, I don't think I really got kidnapped. I think I jumped into the zoo of optometry. And my little backstory is I have a very rare and special eye condition called X-linked retinoschisis, and it's hereditary. And it's proven that I do have it. I've been through all the DNA testing at the National Institute of Health at Bethesda, Maryland. And when I went there, I believe I was the 21st or 22nd person they'd actually validated in person to have the condition. So that was way, way back. There are a lot more people that understand the condition. But so my perspective is from a very unique patient acute point of view. So some of the things I say may not rest well with others, but it's just my experience. So that's how we came up with this. And I've since connected through Dr. Christine Nguyen with Eric Matei and lots of other leaders in this space. And I am truly fascinated in how I can bring my 5 decades of industry and nonprofit operational experience, into the forefront. And there's probably no better way to summarize that. We're going to play a little 6-minute truncated interview with Eric Matei that kindly took the leap of faith to give me a space on stage with him. And we really didn't know what was going to come out, but we talked about process optimization, which has been a thread. Actually, I've been in and out of the sessions, and either using all the different tools, when you boil it down, it's how do we process optimize either the use of data or the use of information or the use of influence in a positive manner for the patient, doctor, customer experience. And that's why I term this session the trilogy, right? It's got to be a trilogy. So anyway, so I don't know if you guys want to add to any of that, or we just want to jump into the 6-minute video clip with Eric giving me a chance to say my piece in terms of what the OD business might be interested in looking at. So
Let's jump in.
Yeah. All right. Let's go for it.
Hello and welcome to this episode of Acrinos Access. We're going to have a really great conversation here on this episode of Acrinos Access because this is all about process optimization. And Bruce is going to present, we'll say, a new lens for your modern optometry practice. Well, Bruce, hey, look, again, thank you so much for joining us here on Acrinos Access. So let's start here. What is the role of process in the modern optometry practice?
Yeah, that's a great question. Of course, like you said, across the life cycle, first of all, it's like if I'm sitting in the chair and the doctor's looking at my eyes, he's going to take a different lens for each unique patient, right? So first of all, you have to accommodate the uniqueness of the practice. You have to accommodate the uniqueness of the size. What I've always found to be true is you always get what you design. And so if your process, whether it's a mature practice, a new one, halfway through a cold start, if you're getting unacceptable results or undesirable outcomes, that might be more of a doctor's terminology, then there's something wrong with the design of the process. It's not the people. And people will very often quickly point the finger back at.
Because to Bruce's point, I think Bruce kind of kicking it off with that we really need to realize that, look, if things aren't happening the way we like, we really need to assess process. A lot of these processes are actually kind of outdated. So now let's dig a little deeper. So in the shoes of the patient, what do these processes mean to the practice?
The process will also mimic not so good things, which the patient may or may not tell you, because what I found is, and I've gotten a lot bolder when I sit in the optometry chair, particularly since meeting Dr. Christy Nguyen. Now, some patients may be a little bit more timid than I am, or they might be in a culture that, they don't dare challenge the doctor, right? So, well, that's just, that guy, Bruce, he's an unusual patient. It's all about having processes that are patient-centric so that you make sure the patient wants to come back. When you're sitting in the chair, the patient should know how they got there, and the patient should have a right to know that the doctor knows why they're there.
Yeah. Fascinating. You're bringing that up on the front of patient journey, because I think, well, for instance, something that comes in very, very, very common, right, is a practice. They look at their practice. They look at the analytics. They like to look at conversions, which, by the way, some people like to call this capture rate. Bruce, I am on a mission. Bruce, join me on this mission to remove capture from our terminology. That's such a negative connotation that we're capturing people. But that being said, I think oftentimes when doctors look at their conversion metrics and don't see that they're hitting it, I think all too often, but I think in the context of this, and I suppose the takeaway for our viewers out there is that if you're seeing aspects of the patient journey that are not converting, explore process just as much as you do explore team engagement and some of these other things. So now let's shift gears and talk about process as it pertains to, I know this is a big can of worms, Bruce, but that is that is practice economics, right?
Okay. So what I'd suggest to you, instead of even anything to do with capture or conversion, what about a collaboration index? Ooh. How well did we collaborate throughout the whole process with the patient, with the techs, amongst the doctors? So think of it as a collaboration index, right? Because if you think of it that way, you've got a total holistic view, good, bad, or indifferent, of what the practice is doing. And here's the golden question, right? The collaboration index can be cemented by either the technician or the front desk or the doctor asking this one question: what could have we done differently or better to make your stay with us more enjoyable or more educational, or whatever the question needs to be? And there are very, very few optometrists that will ever ask that question. If they would, that's all your social media, advertising, patient experience. It all can be grabbed in the listening to the answers to that one key question.
That is fascinating. And I think in the context of that,
productivity, it leads right to your productivity.
That's it. Absolutely. Right? And what you mentioned about the collaborative index.
Yes.
That's really fascinating, because it absolutely does. And so if I'm understanding you, and for our viewers who may be kind of, or our audience who may be kind of like, what exactly is he referring to? Bruce, correct me if I'm wrong, but I'm thinking that this is like, okay, let's look at that. What's a simple metric we can use to measure collaborative index? Presumably it's revenue per patient, right? Just like that per patient spend, right? Because that is telling us, that is the market's way of telling us that we're doing great things, right? Like if they're willing to spend more on the elective procedures, the advanced diagnostics, the offerings out of the optical and what have you, leverage that as the index. And I suppose that then answers that question we were talking about with regard to
Productivity.
process and productivity and practice economics, because you're gonna be able to see it reflected right there in the financials. Fascinating stuff.
And part of that collaborative index also could be, people don't do a good job of really figuring out how did the time go, right? And what I mean by that is, first of all, was the patient on time? Yes or no? Simple to measure. Did we enter the pre-exam room on time? Yes or no? Very simple to answer. Did the practicing optometrist or other specialists, it might be that the technician has to take pictures, might be somebody has to be, did we do all of those patient journey things that are critical to a great eye exam? Did we start on time? Because here's the deal. I found 50 years worth of work. If you don't start on time, you will never finish on time. Never. So the collaborative index is around not only it's time-based and it's dollars and productivity-based.
Love it.
So I just have to say, what a cool way to kind of kick off this event with Eric a few weeks ago. And shout out to Eric Matei. I dropped the link in the feed. Eric does have a booth at the 3D Metaverse. I know a lot of you have been trying to find the connection between, where we are here at the main event, which is obviously hosted on AirMeet, and then the 3D event, which is hosted in our proprietary platform, which is the Omniverse City. And I know a lot of you are just finally starting to get that, but Eric does have a booth. So if you want to go and kind of explore some of what he has to offer, you can do that. But Bruce, how cool is it that you got to start that journey early and now you can continue the conversation here with Dr. Jacobin?
Yeah, and it's, credit to Eric. Eric took a big chance on me, and we didn't have a script. We just had a theme. And again, Eric, leadership has also been a common theme throughout a lot of the sessions. And, Eric, as in front of the trend leader, right? Sometimes you got to take a risk. You got to take a risk on people, and you just got to let them do their thing. And Eric allowed me, again, with no script, no real framework other than, hey, I think it would be great to talk about process optimization, and then the further deeper thinking around the collaborative index. And kudos to Eric, right? And I don't know the business like any of you know it. However, I know the business of process. I know the business of data. I know the business of communication, and I know the business of how do you bring integrated process teams, which if you look at any modern practice, whether it's on the more medical side or just dispensing, right? There are a lot of different skills and people in that practice all working together, ideally to make the patient's journey and experience a pleasant one, an educational one, and one that they want to invest their money in the right things to get their best vision, but more importantly, come back, right? Onboarding new patients. And again, Dr. Rin and I have had some discussions about this. Onboarding can be, to be rude, a crapshoot, right? It can either go really well or it can go really not so well. And the cost and the time and the effort it takes to onboard a new patient, once you've done all that effort, why wouldn't you want to keep them as a patient for life instead of them? I mean, there are circumstances where they have to move away or they have to be referred out of your practice for their eye condition or their health. But imagine being the core coordinator for that patient for the rest of their eye journey life. That's
I think
happening, right?
I think you picked a great student with Dr. Jacobin. I'll let you two kind of carry on this interview and come back in a little bit. But thank you so much for being here, Bruce, to kind of touch on the subject of process. And Dr. Jacobin, take it away.
Awesome. All right, Bruce. So I do have the question outline you sent me. If you want, I can share it up on the screen. But if
sure.
not, then I can just go ahead and.
It's up to you. Let's make it informal. And by the way, if you don't know Dr. Irina, she loves ice cream. So if you ever get to meet her, like I did last week, it was awesome. We sat in a plaza, and we ate Ben and Jerry's ice cream, right? For fun, for dessert.
Yeah, it was delicious.
Yeah. All right. So yeah, let's just chat informally, and then if you could keep your eye on
The
you know,
chat,
any comments or questions, and yeah, we'll have at it. And then I will do a little breakout session to come meet me if people want to shoot over after this. So
perfect. So kind of the first question I have on the list is, what collaborative measures do you use?
yeah, great question. So we briefly touched upon some with Eric, and some of them might be a little bit abstract for people to get their mind around. But again, the real key thing about starting on time, it's such a simple thing to measure, but can be a massive thing in your practice of wasting effort, time, getting discombobulated, and frustrating the patient, right? Now, if the patient shows up late, then they're bad, right? But if they show up on time, and if you start all of your experience, test, conversations, record keeping, if you do all of those things in the correct sequence and you do them all on time, then you will pretty much, unless there's an unusual finding, 90+% of the time, you're going to finish on time. So what does that mean? That means that if you start on time, you can measure it. You can look at that data across a week's worth, a month's worth, doesn't matter how long, but look at the data. And then that will impact, does you then have to ask the technician to stay a little later? The poor doctor probably has to stay way later because they're responsible ultimately for the whole patient journey, right? Either filling in records or signing off things, whatever all those closing operations are for the day. And that is just non-productive time. It's not that you're not being productive. It's just that if you go past the time that you've scheduled and allocated for the good patient journey, then that extra time is all waste. And so that's one thing. Start on time, finish on time. The other things is asking that, somebody mentioned earlier about make sure you ask the patient if they want to opt into helping your practice create a better patient experience or a better customer experience if they're going to purchase something, whether it's products or services, before they leave the office. You have a captive audience. Now, not everyone's going to want to opt in, but for those that do want to opt in, make sure they know why they're opting in. You can measure how many opt-ins you had because you know how many patients you scheduled. You can then measure each day how many opt-ins did you get, and also ask that question of what could we have done differently or better to make your experience or time with us today either more educational, more enjoyable. It can the question can be based upon what data do you want to collect, right? And again, you've got a golden opportunity. So I like to keep measures in three. So time, get real live patient satisfaction or dissatisfaction experience. And then the third thing is, what did they agree to sign up to do next, right? It could be that they realized they need new frames. It could be they needed new contact lenses. It could be, so collect the data on what were the purchasable services or products for each appointment. Now, I'm sure you do that, but you may not do it in an integrated way in one place where you can then analyze the data. So doing data analysis and then using the data to improve your processes, that's the circle. So the collaborative index is designed to operate in a circle so that the patient, the doctor, the customers, including the internal customers like the techs, the record keeping people, the lobby, whatever that role is inside the practice, they are all internal customers to the process. So that's why I love the trilogy: patient, doctor, customer, or doctor, patient. It doesn't matter which way you look at it, but it's got to be a triple win. Because if you don't make it a triple win and use the data to keep making it a triple win, people aren't going to come back. is very simple. They will not come back to a bad experience. No matter how much it's needed, right? No matter how much vision critical it might be, they will not come back to a bad experience. And you can reflect on your own life about that, right? Think about all the times you've got poor service or poor product. Do you go back?
No. And what's more, I've had patients who are, have told me that they don't want to go back to, care that they really need because they had a bad experience at that office.
Right. Yeah. And then the final thing, and this one is really difficult to measure. I mean, you could use some smart recording, but, really make sure you listen. So in my case, it's not so much now, but early on after my early diagnosis of X-linked retinoschisis, which I've been misdiagnosed for from the age of 14 to 39, by the way, it wasn't really the doctor's fault, right?
Mm-hmm.
But the fact that I went on that journey, and since the age of 39, I've had to become a student of my own eye care and the student of my own eye quirkiness, as it were, which I used to be embarrassed about. When I'm chatting to, whether it's the pre-exam tech or the doctor or whatever, I have useful information to share with them that could actually help them learn and do a better job for me. So, there are some things that don't work for me sitting in the chair. They work for everybody else, but they don't work for me. So, if I'm giving the doctor or whatever, the staff member is feedback saying, hey, there's no point you doing that, then that saves time, it saves money, and it saves even more churn if you're using the insurance company, because you've got all these hundreds of different codes that you have to put against time spent in your practice, so that you won't fairly get reimbursed, but you at least get reimbursed for something, right? So there's so many different aspects of not really spending the time and really learning from what the patient is telling you. Now, some patients won't tell you.
True. And I think it's a very delicate balance as a healthcare provider between, listening to your patients and kind of honoring what they tell you and following, kind of the set standard of care that we have.
Right.
Because, you're obviously, very intelligent, what you're talking about, your eye condition well. Some patients don't.
Right.
And yet they insist that, hey, I don't need my eye pressure check today.
Mm-hmm.
Or I don't need this test. It's like, well, you do.
Yeah, so it's back to, then you have to find, what's in it for them, right? It's not, that your standard work has to be followed, and as a caring, sharing, want to do the best doctor for your patient, which I know you are, sometimes that standard work has to be applied a little flexibly in terms of, what's in it for them. You at the end of the day, the patient journey, I mean, you're all there for that patient journey, whether you recognize it or not, right? And I know you and Dr. Christy Nguyen, because I spent several hours in her chair before, and people like Eric and all the other people I've spoken to about this. I know you care. I know you care deeply, and I know you've got awkward patients sometimes. But, having the right process to help an awkward patient become more of a compliant patient is also another thing you've got to really talk about. Sometimes you have to be creative. Sometimes you have to use visualization, show people an example of, whatever it is, but get them to understand what's in it for me. And as a result, what's in it for you is you will do all of the things that you should do for good patient care, right?
Yeah. And I mean, ultimately, that good patient care is for them. Sometimes it just gets lost in the paperwork and the exam processes.
Well, and you gotta love insurance, good, bad, or indifferent, right? And they have not made it easy, for sure. They probably won't make it easier either. So it's that, it's like dealing with something that is a compliance issue that everybody knows that they don't like to do. So you got to get creative around, well, how do we make that even more pleasant for the internal staff or the patient? I mean, I can't tell you how many times, I mean, I recently onboarded in a new, not eye doctor, but a new medical exam routine. And the amount of times I had to fill in the same information, it was ridiculous. I mean, it was just...
Yeah.
And then they said, well, you know, then they pointed at me and said, well, you did it wrong. You should have used the app. So I went to the office early and I showed them, well, the app doesn't work. The link you sent me, and they didn't believe me. So I said, look, here, I'll show you. So cut a long story short, that practice did the right thing. They gave me a number and we called the helpline number and we solved my problem right there before I even went into the doctor's space. So that was a great example of, they thought they'd done the right thing. They thought I had not done the right thing. I showed them that there was an issue and we solved it collaboratively. So, you know, now it took 50 minutes. However, that 50 minutes was so well invested because now I have an app that works. The staff that helped me didn't know some of the solutions to making the app work, so they learned as well. So it was a triple win, and I started with the doctor on time, and I didn't have to complain about, you know, you can't see my medical record, because that was the issue. They couldn't coordinate my medical records across their partnering organizations. So anyway, so, and you know the root cause? The root cause was they put a period after in between my first and last name.
Yeah, you mentioned that.
It was that simple, but had a profound effect on my patient experience and their ability to check me in and be able to present my most updated records to the physician before I got into the physician space, right?
Yeah, and I mean, that's the goal. And I'm really glad that that was resolved for you, because I know sometimes whether,
Right.
you know, it's the office that's too busy or even the support, you know, for these health record system that's maybe not around as much as they could be.
Right. Well, here is the deal. So I listened to, so they wanted me to leave the front desk and go and make the phone call from my smartphone. And I explained to them, well, I can't use my smartphone and look at small text because of my eye condition at the same time. And what was interesting is one of the ladies behind the desk said, well, I don't know how to solve that either. So what was a win for her is when she saw the process we went through and heard the questions I asked and the answers given, because we were on speakerphone, she learned how to solve the problem now for other patients that might have the same issue. So was it a waste of time? Yeah, you could probably say it was a waste of time, but the education that occurred is going to save that rework time after time after time, right? And that's the key thing. If you can get rid of rework every single day in your practice, you can do more with the time that you have, or you can see more patients with the same amount of time. So productivity.
And we'll be thank you so much, guys, for that was a really great discussion. And it's really awesome to see you, Bruce, who really started this whole journey as a patient and through a doctor who's very involved in the industry. Shout out to Dr. Christy Wynn. Had she not been such a champion of the industry, maybe Bruce would have never found that portal, because you are a portal. Like every one of you now, Bruce is reaching out to so many people now and educating them on eye care just because he jumped into the portal of eye care. And the Optical Metaverse is a portal to optical services and eye care services. Dr. Jacobin has been working on my eye care team for a very long time. And gosh, Dr. Jacobin, imagine if we would have built the infrastructure when we wanted to on blogs. I think it would be irrelevant now. I think blogs are going to be a declining tool that people use as more on-demand immersive content becomes accessible. Before we kind of end this session, talk a little bit about my eye care team and how you plan on using this to build a bridge between the patient, and the providers and the community?
Well, so the goal for my eye care team is to have, content that is created by eye care professionals that is also peer reviewed, and reviewed by people, from the general public, so that we can ensure that its value comes in being, well researched. We didn't just have one doctor, we had multiple doctors, or, multiple opticians. And then also, I think having, somebody from the public peer review that content as well, to see, is it understandable? Can it be, understood by because most of the country reads at an 8th grade level. So is it understood at the 8th grade level?
Yep. Yeah. And, that's the other thing is, when the doctors start to talk in acronyms, again, I'm a bold patient. I don't really keep quiet. I will say to the doctor, hey, thank you, but can you tell me that in like 6th to 8th grade English? What did you just say? Now, I may know what they said, but my role is to get them to realize that we don't live in the doctor's world. We don't understand most of the acronyms. We don't understand most of the terminology. So you have to convert it into easy to digest information that can help me have the best vision possible. So, it's like being an interpreter. And I'm a bold. Go ahead.
Well, I was just going to say to that point, we didn't really get to dig into it because the founder wasn't able to stay for the whole event, but Translate.live is a new partner of the Omniverse City and the Optical Metaverse and my Vision Show. And they can also be a partner of my eye care team. And they've created a tool that allows you to translate different languages in real time using AI. And they're already working on a contextual translator. So if you're an optometrist and you're spouting off all of these jargon terms that it'll translate in real time to the patient in terms that they understand if they are at an 8th grade level. I don't know if anybody here uses Grammarly, but according to Grammarly, I use a more unique language than 99.9%. That doesn't mean you're a really easy to understand person, which is frustrating for me because I do try to find that personal translation, but just by listening. But we're going to take a break in a moment. We're going to put these pieces together. For those of you that want to continue exploring, we're going to start giving you tips on how to explore links. You'll see there's a session that we're going to pop up in a minute where you'll be able to connect with us in real time in I call it the mini-verse. So it's a way to float around with your head just by clicking to hear people with proximity chat. And that could kind of give you that first step towards putting yourself in virtual spaces where you can listen to people, and then we'll be taking some journeys into the metaverse. So I'll let you, Dr. Jacobin and Bruce, close our session here.
All right. Thanks, Charlene.
All right. So if you guys have questions for Bruce, we can all meet, and float around together and just discuss some more process cleanup, because this is actually a very interesting topic that, not only are we not taught in school a lot, but this is something that we don't often talk about. We talk about frames and lenses, we talk about disease and new technology, but we don't always talk about just the day-to-day activities that go on in our office that actually really impact both us and our staff and the patients.
Right.
So
and I
Bruce,
think
we got something here.
Well, I think Charlene set up a little meet and greet session, right? It's on the schedule, right? So if people want, to chat with me in that meet and greet, then that's where I'll head. And then when we're done, I'll come back to the floating circles, even though my picture is not there. You'll see me as BC, and it doesn't mean before Christ. It means that
a long time ago, right? So because we'll be this is our last session. We'll be sharing this in LinkedIn to kind of give people some instruction. So this is a really good session to do that because we're talking about the doctor, patient, consumer communication channels, and let's put the providers in there as well. The reps, the app providers, the labs, the frame manufacturers. They're all a part of the communicative journey. Just know when you come into the event, you're going to see alerts going off everywhere. Just click the links, see where they go down the rabbit holes, explore. We had an optician this morning who said she couldn't figure out how to create her avatar. So she called her kids in And they did a Roblox rescue. They're like, "Hey, mom, this is kind of like Fortnite, kind of like Roblox." And her and her two kids, who probably don't spend a lot of time talking about the optical industry with her, they helped her create her avatar, and they were exploring the convention center with her. So if you can't figure this out, call a child. They can help you.
Or call Princess. Princess is
Yes.
an amazing resource on your team, and she helped a bunch yesterday. She's very smart. Great high potential leader there, Charlene. So
Oh, she's incredible. Yeah, shout out to Princess. And, since we're wrapping up, thank you to every one of you, to the Optical Metaverse troop. Oh my goodness. I never expected some individuals, even one individual, to stay for every single moment. And some of you did. And I
right.
hope you enjoyed it. I mean, I guess you wouldn't have spent 3 days with us if you didn't, but we're kind of signing off, but we're kind of just starting. So thank you for being here.
Hey, last point on that. The people that did stay, you have gotten yourself a crash course in not only up to date, but futuristic processes for you to think about. And I would encourage you, because I was what we call a newbie. Like 7, 8 months ago, I was a newbie. I'm a baby boomer. I'm not a techie. I don't need to be a techie, but I'm journeying from a newbie to becoming hopefully a navigator to help other baby boomers like myself understand what is the power of why you need to do this now. Do not wait. If you wait, you'll be standing at the train station, and not only will the high-speed train go past you, but in a few years or less, there will be no trains going by that station. So you won't even be able to get on the train. So I would encourage you.
Good visual, very good visual. And, that just to be clear, this event is actually not over. This is our kickoff.
Right.
We're now starting. The event is over. The Optical Metaverse event is now concluded. And this kicks off season 3 of the Omniverse City. So get in and explore it. It's so beautiful. The team did such a good job. The Omniverse.city. Click explore the Omniverse. They created this beautiful new lobby. There's 2 escalators, so there's a second floor, and just go into the spaces and you'll see a click G to teleport. I mean, we could all click G on our keyboard. If you get stuck, let us know, but we look forward to continuing this journey together.
Sure, and come see how a newbie is going to become a navigator in the process cleanup store. It represents my core, which is to do everything simpler, faster, better, and sounds simple to say, but took a while to get there. But the team, Charlene and the team, we got there. Amazing.
We'll see you guys soon.